So I want to say a little bit more about the difference between psychosexual therapy and general psychotherapy. There is an overlap, and psychosexual therapy is built completely on a very solid foundation of general psychotherapy skills. But there are some very specific things that psychosexual therapists work with that general psychotherapists don't. And they're around what we refer to as sexual function problems. Now, who gets to define what a sexual function problem is the subject of a whole entire other presentation and video and maybe course. So that's not something we can cover straight off here, but it's a flag to say so-called sexual dysfunctions are defined by people in power, people in a majority. For psychotherapists, we're interested in what the client thinks is a problem for them. So specific psychosexual problems might be problems with erections, ejaculation, either being too soon or delayed as defined by the client, painful sex, lack of interest or desire. Those kinds of themes are the kinds of themes that psychosexual therapists train in specifically on top of their general psychotherapy qualifications and knowledge and experience. And general psychotherapists don't typically train with those specific presentations in mind. That's the core difference between a general psychotherapist and a psychosexual therapist, and what you might be thinking about when you're thinking about what you want to train in and specialise in, or in the problems you might want to take to a therapist if you're a client who's listening to this clip.